Hello, your kidneys an amazing gift from God. And as one of my senior colleagues and mentor pointed out in our inaugural lecture, they are for your purification and good health. You need to take care of them. So we started this series on understanding and preventing kidney failure. And I'd like us to focus in this discussion on one aspect of it that is very important in this environment in particular. How do we use drugs? How do we take drugs? What impacts can they have on our kidneys? Now, your kidneys, like I pointed out in the first discussion, are paired organs. And you can actually live with one. So God gave us two, in case something happens to one and you have still a good functioning one, you can live a normal life with it. And that's why some folks are able to donate their kidney to those who kidneys are failed. And perhaps that's one of the reasons why God gave us two. Now, having said that, it's also important to know that I did mention that most of the time, the disease that affect the kidneys affect the two simultaneously. That's what they call systemic diseases. And so it's essential that we really pay attention to protecting our kidneys so they can serve us, for a long period of our lives effectively and efficiently. Now, your kidneys are just about the size of your fist. In length, they average about 10 to 12 centimeters, in width, about 5 to 7, and in thickness, about 3 to 5 cm. That's the average, dimension of the kidney. Incidentally, too, in Africans, we're a little bit, below that average for Caucasians. And so the average length in Africans is about 9 to 11 cm. And so when your kidneys shrink to sizes below that normal length, it's an indication that something is already going wrong with your kidneys. I also need to say that in terms of the microscopic structure, you have the essential functional unit known as the nephrons that filter your waste products. I liken the kidney to the waste management agency of the body. Your body is like a biological factory that on a daily basis carries out a very efficient industrial process of handling the food you eat, digesting them, bringing up the essential elements that are needed for your body function, glucose for energy, amino acids for tissue repair, and also fat derived from your foods for energy as well. And the role of the kidney is that at the end of that process, just like in every industrial activity, there is always some waste products, and the responsibility of the kidneys to a large extent to safely, ease off these waste products from your system. And that's why your kidneys are very important. And once they fail to function, these waste products accumulate as toxins in your body and cause health challenges, and ultimately, if not managed, to lead to premature loss of life. So there are nephrons that help you to filter these waste products, and as small as the kidneys are relatively, and by the way, in terms of dimensions, your body size determines your size of your kidneys. Your body's mass index and your body surface area actually reflects the size of your kidneys. And these organs are very important in handling drugs. Most of the drugs that you take are metabolized by the kidneys. In terms of excretion, in terms of even producing their active products. Not all drugs that you take, act or provide the activity you need for your body in their original form. Some of them have to be broken down, what we call metabolized to what we call active ingredients that carry out the activity we want them to carry. Now, the most important drugs that are misused in this environment are painkillers, what we call analgesics. And because pain is a very common emotion, it can be distressing, and once anyone is experiencing pain, the easiest thing for such a person to do is to get across any local drugstore and purchase medications, especially the ones we call the non-steroidal anti-inflammatory drugs. Some of these drugs are actually over-the-counter medications. You can get them without a doctor's prescription. The likes of ibuprofen, for instance, aspirin, and another one called naproxen. In countries where these drugs are strictly regulated, you can't get these things over the counter. But in our environment, there's hardly any regulation at all. People just buy anything, including antibiotics, which is another class of drug that can affect your kidneys in a very destructive manner if they are taken inappropriately. So these drugs cause what we call interstitial nephritis. Now again, I go back to the structure of the kidneys. I talked about the functional units, which is the nephrons, made up essentially of blood vessels and tubules, small tiny tubes called tubules, through which your urine flows, right out until you pass them out, through after initial storage in the bladder. Now, these interstitial tissues are the supportive tissue that surround the kidney nephrons. They provide support from them, in the way the body, the physiological mechanisms of the body, they are very important in how your body fluids regulated, how the urine that comes out of your system at the end of the day is of the appropriate constitution, and such that maintains a normal health. If urine is too concentrated, it means that your kidneys are absorbing a lot of water, or you're not taking enough water, and that can also cause problems for your kidneys. If they are over dilute, it means that your kidneys are not reabsorbing back enough water from your system, and that means something also is wrong. All these could reflect, some problems with your health, and that is why when you go to a hospital, they are doing the urinalysis, they do one of the parameters they check is what they call specific gravity, because they want to know if your urine is of the right composition for normal life. So the use of painkillers is one of the especially abused inappropriate amounts and duration can actually cause damage to that supportive tissue, the interstitium of the kidneys, and ultimately, if persists for a long time, for several months, anything from 3 months and more, can result in chronic kidney disease and kidney failure if untreated. The other drugs that people abuse in the environment, which are actually supposed to be prescription drugs, in other words, you cannot ideally walk to a pharmacy and purchase antibiotics without a doctor's prescription. But in our environment, in the African countries, for instance, it's so common for people to, obtain antibiotics without a doctor's prescription. Antibiotics can cause kidney damage, and if you take them for too long a period, they also can cause kidney damage. And so my advice is that ensure that your drugs that you obtain from any pharmacy are backed by some advice from your doctor. And do not take them for prolonged periods, even if you're taking a pain medication, absolutely for no longer than a few days. And if you're not getting better, seek the advice of your doctor. I'm well aware that drug marketers, in advertising their products, often will tell you, even after so and so number of days, the symptoms persist, you are advised to see your doctor. I hope this has been helpful. Thank you, and God bless.